been to a doctor's office, an urgent care clinic, or experienced a hospital stay or an emergency department stay, chances are you've been cared for by a registered nurse. Registered nurses are an integral part of the flow within the healthcare system. They are their doctor's eyes and ears. They advocate for their patients and administer life-saving medications and treatments. So when we think of the word nurse, we think of being nursed back to health. Nurses are the ones who are supposed to get us feeling better and back to our daily lives and daily routines. But what happens when we or our loved one are told that we're not supposed to get better, that the sickness or the illness that we have is ultimately going to kill us? And so that is where hospice nursing comes into play. So hospice nursing is nursing in its rawest form. If you take away all the advancements in medical technology and all the life-saving measures and interventions that we have in the healthcare system, you are left with just a nurse caring for a patient's basic comfort and basic needs. The dynamic of hospice care is different than regular nursing care in that it is not meant to prolong the number of days left in a person's life, but is meant to increase the quality of life in the days that they have left. So the care plans in hospice care are greatly centered around patient and family's wishes and requests. So you're often not going to see any life-saving measures put into place, such as like a patient taking their blood pressure medication or working with therapies to try to get somebody stronger so that they can go home, because that's not the goal of hospice care. Hospice care is defined as care that is given to people who have 6 months or less to live, or who are having a terminal illness experience. So this could be someone with late stages of cancer or with advanced stages of Alzheimer's disease. You can see hospice care in a variety of settings. So you can have it in a hospital, you can have it in skilled nursing facilities, and you can also have it at home, which is where most people choose to have hospice care. As someone who's worked in both hospital and skilled nursing facility settings, I can tell you from experience that I have worked with many families and many patients who have loved ones who are actively dying, and treating them with dignity and respect, both pre and post-mortem. I've gotten a lot of feedback from the families that I've helped, and they have all said that it's been very, very helpful to have that support during that time. So today I kind of want to talk to you a little bit about what hospice nurses do, what are the qualities that make a hospice nurse great at their job, and also a little bit about why so many people tend to shy away from choosing hospice as a career because of, okay, so if we, so what do hospice nurses do? So in every nursing specialty, the RNs within that specialty will perform different jobs. So that's the same thing with hospice care. So in hospice care, you usually have an admission nurse. These are the nurses that will determine your or your loved one's eligibility for receiving hospice care. And they work directly with the doctors to try to place you in an appropriate facility to receive the best care. You have staff hospice nurses. These are the ones that will work with you or your loved one most often. They are assessing the patient and looking for changes in conditions such as further deterioration or impending signs of death, which is very important. And they also administer most often pain and anxiety medication. You have case manager nurses, and these are the nurses that are assessing your care plan every day to make sure that the patient's current needs are being met, as well as anticipating any future needs that they might have. So regardless of their job that they do in a hospice setting, they all share the common goal of educating patients and providing support and resources during a very difficult time. So if we look at what makes a hospice nurse great, hospice nurses perform a really important service for people in a really difficult time in their lives. When I think of hospice nurses, especially the ones that I've had the pleasure of meeting in my healthcare career, I often just think of the word joyful. Hospice nurses are masters at building connections with people. They're there to help the patient's comfort level increase, and that can in turn make them less fearful of death, which can make it even a more peaceful experience for everybody involved. They are very thorough, so they want to make sure that they're managing your pain and that your comfort level is adequate. They are very dedicated to their profession. So hospice nurses are some of the most dedicated people that you'll ever meet, because they want to use anything within their power and within their means to make sure that your needs are being met and that everybody is comfortable and as relaxed as you can be. So Jillian Faulkner, she's a clinical director at Unity Hospice, and she was quoted as saying that hospice care isn't a job, it's actually a calling. But if we looked as third-party observers at hospice care, you know, as potential nurses, as current nurses, or anybody working in any job field, if we look at it at a job standpoint and wonder, why do so many people not want to choose hospice care to spend their life doing that work? And so according to the Nurse Journal, they did a study where it had participants list off pros and cons of why they think it would be a good idea and why it wouldn't. And you know, no surprise, the number one con was that it would feel hopeless or depressing taking care of people who are constantly passing away, constantly dying. Other cons listed were it tends to be lower paying than other nursing specialties, which is unfortunate. And it tends to have kind of less adequate staffing ratios in hospice facilities. They can be overworked a lot. Other smaller cons that weren't listed as high are it can tend to be less, it gets less esteem within the healthcare community as opposed to like more prestigious areas, more specialized areas of nursing like cardiac nursing or neuro nursing. So as opposed to the cons, there was one major pro that was listed, and that was the people who believe that being able to help someone in the final days of their life would actually be rather life-changing, to help them through the stages of grief and to help them prepare to die and die with dignity and respect, and also to, most importantly perhaps, make sure that nobody dies alone or feeling unloved. And so that's a big area that hospice workers really do good in. So there are two things that we have in common as human beings, and that within our life journey, and that is the milestones of birth and death. We are often scared of death. And Socrates, who's a Greek philosopher, was actually quoted as saying that death is perhaps the greatest human blessing that we can get. So it is inevitable that we at some point in our lives will face interaction with hospice care workers, because it is true that none of us will live forever. And it's just important that when you think of dying, that you're not fearful when you have to interact with hospice workers, because they are very skilled and knowledgeable at what they do. And chances are you will find great comfort in their presence with you and your family when you are working with them. And that is the same kind of comfort that my family's received with hospice care. So we're very grateful for that.